Before we officially get started, I just want to check with everyone because we have some additional guests, we normally record our Rotary meetings each week and post them to our YouTube page. If we have anybody who objects to that, please let me know in the chat. Or if you'd like to just shut off your video, that would be fine too. But that's normally what we do. Angie, are you okay with us recording your portion of the meeting as well? And Kerri, are you okay with that if we record this and post it to our YouTube channel? Okay, great. Thank you so much. Thank you to Shane for being our greeter today. It's time for the Pledge of Allegiance. If everyone could please rise and join me in the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands,
one nation, under God, indivisible.
Liberty and justice for all. Thank you. Time for our moment of reflection, and today's moment of reflection is brought to us by fellow Rotarian Jerry Malumbi.
Yes, I checked with the little book I have here called Abraham Lincoln, The Wit and Wisdom of Abraham Lincoln. So I thought I'd, given what's going on in Washington, D.C., try to bring us some wit from 150 years ago or more. Responsibility. In times like the present, men should utter nothing for which they would not willingly be responsible throughout time and eternity. Abraham Lincoln.
Thank you, Jerry. Time for song time. And for today's song, I figured, things have been a little hectic in the world lately, so we'd try and make things a little more upbeat. So we're going to go with one of my favorites, and that is Smile. All right, so hopefully we can all keep a smile on our faces, even though we're all at home and, isolating and things of that nature to prevent spread. So. Okay. Introduction of our guests. We have a number of guests with us today. And introducing our Sorry, I was muted there. Sharon, could you please introduce our guests today?
Forgot to unmute myself. Okay. Forgot to unmute myself. So yes, I'm very happy to welcome several guests today. The first person I'd like to recognize is Kelsey Wright from our new satellite club. Welcome, Kelsey. Or Beck, our visiting Rotarian. Welcome, Or. I'd like to ask Faith Miller to introduce her guest, Shelley File.
Sure, I have Shelley File. She's one of my fellow faculty members. I did mention in our school meeting today that we were going to have this discussion, and I just dropped the link in the chat. So I did also mention that Angie might start speaking at about 12:30. So there may or may not be some more folks jumping in on the call. So welcome, Shelley.
And
Thanks for
last
having
but certainly not least, we're very happy to welcome Angie Bailey here today and her colleague Kerri Gail. Kerri is the Environmental Health Director for the Jackson County Health Department and also the Public Information Officer for the COVID response team. Angie is the System Director for Community Health and the Community Liaison for the Southern Illinois Healthcare COVID response. And I think it's fair to say we're all very anxious to learn about upcoming vaccination possibilities. So welcome to both of you.
Thank you, Sharon, and welcome to all of our guests today. Club announcements. Our club officer election for Rotary year 2021-2022. If you have a name to suggest for those, we have had some discussions with people to fill some of these vacancies. But if you have additional names, today is the deadline to get those submitted so we can bring them to our board meeting next week. And then the following week, we'll have our election. So please reach out to me if I haven't already spoken with you. For those of you I have spoken with, thank you. And please get those names to me soon if you haven't already. Our foundation donation challenge, we are doing a up to $100 match to donations to our club foundation this year. Continuing this, I believe we've done it for 12 months already. So I want to thank everyone who's already done it. Thank Harvette and Carl and Linda and Pam and Christine and Shane and Faith for all volunteering this year to do it. Who's up next? There's none that says we can't continue this. So thank you all for your support. Club duties, also helping out each week. So I want to thank those who signed up today to take a role within our meeting. Please check out the link. It does get sent out each week, the Doodle Poll. So our next week, we don't have a meeting. We'll have a social event where we can watch the inauguration together and still gather, still chat about Rotary as we're doing so. January 27th, the link is right here for the Doodle Poll. So we need people to sign up to be greeter, Pledge of Allegiance, 4-way test, etc. each week. Our 100 Little Things project for our guests that have joined us. This is our centennial year as a Rotary Club. We've got 100 years under our belt here. So we decided to do 100 small service projects throughout the year. Things we've recently completed: 100 Toys for Tots, 100 eyeglasses to go to the Lions Club. We had thousands of cans of food donated through the Scouting for Food drive that we supported. We've got Meals on Wheels, current projects underway, gun lock donations. Sharon, I need to get with you. We have, I did pick up a whole bunch from Shane that we need to get over to them. Our entire list is available at rotaryofcarbondale.org/centennial. Active service projects, we're continuing the lunch project at the Carbondale Warming Center. Sorry, I see some people in the chat. I can't see the chat right now, so I apologize for that if you're trying to reach out to me. There it is. Okay. Is Rick providing food for everyone for our social? I'm going to go with a negative on that one. I'm not. We shouldn't all be together socially, so we're going to be social distance on Zoom for that. But we are providing lunch for the Warming Center. Today's lunch is barbecue pork sandwiches, baked beans, potato salad, tossed salad, and Rice Krispie treats. Those sound delicious. So we do support that by continuing to pay Heartland Catering. So we're supporting a local business and the Warming Center. That comes from the cost of what our meals would have been if we were meeting in person. So thank you all for your continued support with that. And Jim announced last week that we had the funding that we were continuing that on. Some district news. The Rotary Satellite Club for Murfreesboro, sponsored by us, is official. It's on the books. And we discussed last week, for those of you that aren't here, our club actually got a $500 prize. We haven't gotten that just yet from the district for being the #1 percentage growth club in the district from August to December. So great job, everyone, for bringing on new members to our club and for helping us launch this satellite club. Our district grant project, we're wrapping this up. We do still need some funding to finish up our contribution to the Kiwanis Club project for the all-inclusive playground at Turley Park. So if you haven't driven by or haven't been there lately, they do have some of the equipment already up. Phase 1 is complete. They're in phase 2, fundraising for phase 2 right now. So we want to continue to support that project and finish that out here soon. Rotary International news, coming Rotary year, protecting the environment is a new area of focus for an official cause of Rotary going forward. So we're really excited to have that, and that's an opportunity for us to look at projects in the coming year that we can do to help sustainability and protecting the environment. Rotary International news, the countdown is on to eradicate polio, and this is right in line with the guest speakers we have today about vaccinations. And thank you all for your support of the Polio Plus Foundation and the fight to eradicate polio. This is the most recent update. I had an infographic for 2019. There were 176 children paralyzed by polio. In 2020, 138. So that's a nice drop. It's still not zero. So the more work we can put in and the more support we can provide will help eradicate polio worldwide. Let me check the chat here if I can. Doesn't want to pull up for me. Now it's time for some of your good news. So I'm going to stop my share and check out the chat window and open the floor to anyone that has some good news they'd like to share.
Well, Rick, I'd like to share, when you're looking through the chat window, I think we elected you to be a Grubhub delivery service and bring snacks to everybody for the social event next week. What do you think about doing that?
We are spread out across Southern Illinois, from West Frankfort to Heron to Murfreesboro. I'm not sure I could get fresh snacks to everybody's house all at once. I could do my best if somebody has requests and lets me know specifically, but the least I can do is be on that call and join everybody for that social time.
Well, you could deliver to Gil. He's in Florida. At least you get to see his son.
Yeah, Florida. That's yeah, very funny, Shane.
I have some good news. My wife successfully completed her knee replacement, and I'm head nurse, and things are moving along, so we're real happy.
Since it's not a visitor introduction, Kelsey Wright, who is one of our Murfreesboro Rotary Club new members, is also here today.
So I have some good news. Since we're talking about vaccines today and COVID, my wife has had both of her vaccines. My daughter-in-law has had both of her vaccines, and my oldest son's had his first. So needless to say, they're all in healthcare.
So I did see on the news.
Sorry about that.
I saw on the news this morning a report about Salvation Army and how well they did with their fundraising. So I wanted to say that, I enjoyed doing that this year, and thanks to everybody who helped, and they did a great job. So I was really excited to see how well Salvation Army did with their fundraising, and proud of our club for being part of it.
Just real quick, a quick shout out and happy Founders Day to my fellow Greek sister in Crimson and Cream, Ella Lacey. And later this week, Founders Day, heads up to my fellow Greek sister in the blue and white, Dr. Linda Flowers.
Can I do you? Can I?
Any other good news to share today?
I happen as well. No.
You have some good news, Carl?
I think I do. Yes, I just wanted to, since we are extending Happy Founders Day activities to the Divine 9 members, I would want to extend a Happy Founders Day to Faith Miller, who is a member of Alpha Kappa Alpha Sorority Incorporated, and their Founders Day is, I believe, on Friday. Okay, that's it.
You got it. Thank you.
All right. Well, thank you all for your good news. Sergeant at Arms, Will is not joining us online. Gail is out of town right now on an on-site job, so Shane has offered to be the fill-in Sergeant at Arms today.
I've been waiting years for this opportunity. After being club president and having to deal with Will Travelstead being Sergeant at Arms, now it's my turn. And the first one I want to point out is the sponsoring Rotarian that sponsored me to join the club is Gil Cronin. Hey, Gil, what time does the meeting start?
At 12. Well, I thought about time it started, but I was tardy today.
Yeah, well, welcome to Rotary. There's a few others that were late today. I won't point out that, you know, the ones that joined in late. But if you feel the need to donate to the club because you're a little tardy today, the club could definitely take that money.
Nursing.
So, yeah, you're probably working on a tan and you forgot what time it was.
No, that wasn't it. I'll volunteer to pick up the next month on the $100 for next, what is that, next June? Is that the next available month? I'll pick that up.
Well, there you go. Peer pressure works every time. Well, if anybody else has anything, if you've done anything naughty, just send Jim Grant a check. The more zeros, the better. Behind the first dollar bill, those are always good. And I look forward to seeing what Angie's got to tell us today.
Well, thank you, Shane.
I think, and one more thing, just a recognition. It was early on when people were first coming on, but on Monday night, she had been in a care facility over in Heron, and she passed away during the night. And from what I understand, had a good day the day before. So I've known Edie since I first came to town about 50 years ago or 40 years ago. And I was glad to see her pass comfortably. So, but she was a member of our Rotary Club probably about 20 years ago, and actually went to Japan as an ambassador for our club to the Nakajo Rotary Club. So,
I missed that. There was a cutout on your voice. Who passed away?
Edith Spies.
Oh, Edie. Oh my goodness.
Yeah.
Yeah, I was with her in Japan.
Yeah. She was quite a Rotarian, quite outspoken.
Yeah.
That's it.
Thank you for sharing again, Jerry, for everybody who missed that. And it's really unfortunate, but at the same time, you said, you know, you're glad she passed comfortably. So that's the most we can hope for. And I'm glad she had an impact on you and everybody else in this club. So thank you. We're going to transition now to our guest speaker. I'm going to stop my screen share. We've got Ms. Angie Bailey and Kerri Gail from SIH and Jackson County Health Department, respectively. So I'll stop my share, and Jane, can you grant Angie the ability to share here so that she can have the floor? There you go. So Angie, you should be able to share now, and the floor is yours.
Okay.
Thank you for joining us today.
Great. So I am actually going to share a little bit of information from SIH. And then I really want to thank Kerri Gail for joining me today, because I knew you were going to have a whole lot of vaccine questions. And I know that's the thing on everyone's mind. So from my perspective, as mentioned earlier, I serve as the community liaison for SIH, so working with a lot of different organizations as well as the health departments. And so they are doing so much work right now with the COVID vaccine. I just want to make sure a couple things and give a couple announcements, and then I'll have Kerri take the lead on the vaccine section. And Kerri, I can bring up the health department website and anything you might want,
Okay.
if you like. So we do continue to send out that SIH COVID update. It's on Thursdays. You should get it around noon. We try to get it out as close to noon as possible. So you'll see different links. And so we try to include those media stories we think are pertinent and other things. So please watch that. I can't see everybody's faces right now, but I hope you've signed up for that. If you have not, you can go to our Facebook page for SIH, and then there's a link that has some data. You can click on that link and then join to get those once a week. Other things, we are doing the monoclonal antibody infusion updates. To date, we have given 133 patients one of the infusions. There's currently 2 drugs available. So these were last week's numbers. So, but as of, I think it was yesterday, it was 133. So if you or any of your loved ones ever have COVID, there are some criteria to get that, and the criteria are listed there on the screen. It must be given within 10 days of symptom onset. We've seen really good results with individuals improving. So you can see some of those criteria there. Your way to obtain this would be to talk to your healthcare provider, and then they can talk with SIH staff and put an order in for you to receive that. And it's being given at our infusion centers. So St. Joe's might be one of the locations a person may receive that, as well as the EDs. So that information is available. And then as far as the vaccine prioritization, you know, there are currently the 2 vaccines. There's lots of recommendations from IDPH and CDC. Even though I'm not a frontline staff person, I was one who was able to receive the vaccine and have had my 2 doses. Very excited about that. I was one of those. It was going to expire and go bad if some individuals didn't receive it. So I got to jump on that as an SIH employee. So glad to have had it. My symptoms were very minimal, a little soreness in the arm the very next day, and then a little tired and a little bit achy, but nothing that a little bit of Tylenol could not take care of. So, and you'll hear different people with different issues. So that's some information. Then I'm gonna, Kerri, I'll bring up, I can't see you right now, but I'll bring up the health department website. And if you would want to talk about the vaccine, you know, or the health department and how individuals can gain information and the phases of things.
Okay. All right. Well, first of all, I want to thank you for having me today. I appreciate that, to have some good people to talk to and to get our information out, because it's really important to us. So as you can see, last week we started the COVID-19 vaccination weekly update, and that is going to be done every Friday. We will send that out. So there's a couple ways that you can get it. So you can get it off of our website. It'll be on the front page of our website. And then also there is a option called Nixle. And so nixle.com, and you can sign up, and that is through the Jackson County Emergency Management System. And so they will be able to, every week they'll send out a link to our update. So if you sign up for that, you're guaranteed to get it through a text and an email, if that's what you put on for your sign up. So that's anybody in zip code, you just put in your zip code. And if you're in Jackson County, that's what you will get. So just a reminder to get signed up for that, because I think that would be very helpful for everybody to be able to get that information out. Currently, we are vaccinating in phase 1A. So that is healthcare personnel with direct and indirect contact with clients and patients. So in long-term care facilities and assisted living facilities are registered through the Federal Pharmacy Partnership Program. So that is not being done by us. That's through a program through CVS and Walgreens. And so they'll be getting their vaccines for their staff and their residents through that program. Starting on Tuesday, tomorrow, first of all, and back up, starting tomorrow, we will release at noon. We are going to open up to phase 1B. So as you can see in our update there, that is frontline essential workers and anyone 65 and over. So starting tomorrow at noon, you will be able to schedule starting next week through February 4th, every Tuesday and Thursday, you'll be able to schedule an appointment for a vaccine. Currently, we have Moderna on hand. We do not have any Pfizer, so that's the vaccine that we will be giving. Just trying to think if I had anything else. Does anyone have any questions?
So, Kerri, I'm over 65, obviously, so I can just call the health department and make an appointment?
Actually, tomorrow at noon, you'll be able to go to our website and there will be an option for you to schedule your vaccine. Okay.
Thank you. Thank you.
Very exciting. I got my vaccine today, so I'm very excited. Yes. Any other questions?
Yeah, Kerri, I have a question. I see that teachers are defined as K through 12, and at least on the part of the screen I can see, there's nothing about universities. Do you have any information about that?
So per IDPH, universities and faculty are not included in the education portion in phase 1B at this time.
Wow. But is there any plan for them other than the general population?
They would be then in the phase 1C general, yeah, everyone else basically, yes. And things are subject to change as we move forward. It always, what I say today, as far as those types of things, every week we get something new. So signing up for that update and checking our website is the best way to stay informed, because we try to keep it as up to date as we can on a weekly basis.
Kerri,
Where
this
is the
Shane. I have a
location for these
question for you.
vaccinations?
Okay. Go ahead, Shane. Go ahead and
The question I have for you is under phase 1C, you talk about high-risk medical conditions. Do those have to be certified? How do you prove that to get a vaccination?
We have discussed that just a little bit. We haven't made that decision on how we would do that. I think when we get to that point, I really feel like we're not going to be able to ask those questions, just because it will be cumbersome on the scheduling process and then when you get there. So I think we're just going to have to trust people as we move forward.
Okay, thank you.
Where are these vaccinations administered?
So they are not here at the health department. We are actually right now scheduling them, and we're doing them at the SIU Arena at the West Lobby off of Douglas Drive. You will park in lot 52.
And Kerri, there are individuals on the call, even though this is Carbondale Rotary, that may live in Williamson or other counties. So one thing to keep in mind is each health department, and you clarify or correct me, Kerri, each health department has their own instructions or rules or way to schedule. So you'll want to check with your health department. Most health departments have information on their website or their Facebook page. So those are great ways to get information and updates for the county that you live in.
Yes, and all of our, thank you, Angie, and all of our neighboring counties. So Franklin, Williamson, I believe Perry, and Southern 7 are all starting phase 1B next week. So if you live or work in one of those counties, you will be able to get your vaccine if you fall in that criteria as a frontline essential worker, healthcare personnel, or anyone 65 and older.
Is there a preference if you live in one county and work in another? Which one should take precedent? Because I live in Franklin County and work here in Jackson County.
There's what would be convenient for you, really. That's what I would say. What would be convenient for you?
Okay.
So if I read that,
How long is the vaccine expected to be administered at no charge? Because that might be a motivator for people to get in on the first wave reluctantly or willingly or whatever. Is it ever expected to be a charge after, say, 2021, 2022 even?
I mean, I would say the longer we are in the vaccination process and the more providers that probably get it, I would see that changing. At this time, we have no intention at this time to charge at this time.
I believe the federal government is paying for all of this.
Yeah, well, in more ways than one. The dental community, dentists specifically, there'd been some discussion of them being trained to be able to provide the vaccine. Where is that? Do you know?
I do know that we are IDPHs. We are all working with all of our healthcare providers in order for them to get signed up. So there's a process not just to give the vaccine, but a process for getting the allotment and then being able to report that back to the state. So there's a process, not just giving the vaccine, but a whole line of information that has to be done with those clinical workers that are able to give it. So right now, at this time, it's just us and a few and SIH, and then we're trying to get some other healthcare providers on board to do that.
When will the phase 1B vaccinees get their second shot?
So with Pfizer, it is 21 days on or after your vaccination, and with Moderna, it is 28 days on or after your first vaccination.
And you anticipate that Jackson County Health Department will have that second shot available for those of us that get the first one?
As far as we know right now, that is the plan. Yes.
Okay. Good.
Are any of the physicians who are in the SIH that are part of SIH giving the vaccine in their offices?
Not at that time, not now. And that again is all at the direction of the health departments. So we are really taking the lead from the health departments and what vaccine they give us. And then they direct us on our next steps. Any corrections or anything else with that, Kerri?
No, that's correct. Mm-hmm. And a lot of that right now has to do with the allotment that's being given to the county. So, we're only getting so much, and we don't know until the week of kind of what we're going to receive.
A question for Kerri. For the arena post where vaccinations are given, do you have any idea how many booths you expect to have that people will receive immunizations at? Any anticipations of length of lines or anything?
So we schedule people every 15 minutes, and there's also a 15-minute recovery time with this vaccine. So we ask you to sit in the observation area for 15 minutes. So we have our clinics set up to where you would schedule your appointment, you will come in, get your vaccine, and sit in the observation. Right now, we're doing about 20 people every 15 minutes. We have not seen any lines because we're controlling that and trying to control that with the scheduling opportunity.
Okay. And for Angie, you mentioned having been able to get the vaccine because there was some risk of spoilage. Did you end up having some spoilage, and has that problem been corrected in terms of having a call out to the public or someone?
Yeah, so within SIH, we overscheduled for that day, knowing that there were individuals like me who weren't not necessarily frontline people that were interested. So to my knowledge, we did not have any spoilage. We used all the vaccine that we had and made sure that it was utilized.
So if I'm reading it correctly, utility workers are in phase 1C?
That is correct.
Okay.
And we are also handling our vaccinations like SIH so that at the end of the day, we don't have any unused doses.
And in our case too, people were called in and said, we just weren't gonna let any waste. So people were called in to say, hey, we can get you now because, yeah.
We register on the SIH website.
No, for the vaccine, you'll register on the Jackson County Health Department website, and that will not be released until tomorrow at noon. And so it is the jchdonline.org.
And we'll make sure to put that in the chat so you can have that exact address, and we can also include the Nextel information in the chat as well. I think, is there anything else like that would be helpful in the chat?
I'm curious about tracking the people who are getting immunizations for a couple of reasons. One is, are you tracking so that they don't get followed up? And are you tracking to make sure that they're getting something compatible with the first immunization?
Yes, so all of the information, all the doses are entered into a state system called iCare. And so that we're able to see what dose that you got the first time that you signed up. And so we also, with our scheduling system, once you sign up for the first dose, you'll get a reminder to sign up for that second dose. And it tells us what clinic that was and what vaccine was given. And then also everyone that gets a vaccine is given a card, and we ask that you bring that vaccination card back with you when you get your second dose. And so it will have the type of vaccine, the lot number, and the day that you're due for your second dose.
And then that information too is in their update, and take a picture of your card front and back too would be a good idea. I thought I lost mine the other day, and I had gotten it stuck in some papers, and I was so worried, like looking for it. So the taking a picture is a good thing as well.
So I wanted to ask a question if I could. How are you guys combating some of the disinformation that's just out there? I ran into somebody yesterday that there's so much resistance to the vaccination arguments and just things that are like, I had to like look cross-eyed at them like, did you really just say that? But it just seems like it's so commonplace. How are you sharing information that is accurate and up to date about what's in the vaccination, what random thing that's circulating on Facebook or the internet that is absolute, silliness? How are you dispelling some of that right now? How do you deal with that?
We ask here that you just continue to follow all the trusted sources such as SIH and our website and the health department Facebook page and Twitter. We ask that you follow those trusted sources, IDPH and CDC, and not just the general things that are posted out there on some of those social media sites. So continue to follow those trusted sources.
So I totally do agree, but for some of us who are advocating that, we want to see this thing over. We want to see, people get and accept the vaccine. And like, I sat in an office yesterday where somebody told me they absolutely positively weren't getting it because it has monkey DNA in it. And like, the straight face, not a joke, 100% dead serious, and passionately defending that. It's like, I would love to have, referral, like actual SIH type material that I can say like, look, here's some real information that is helpful that I think you need to read and brush up on. How do you deal with that in the healthcare world?
So one of the things, I mean, we have that information on our website, and I can share a little bit. You can go to the SIH website. Let me see if I had it up a second ago.
I know I'm not the only one on this call who is just dealing with, like, you have people in your friend group who are just sharing some of the most insane things out there. And it's like, you want to just ignore it, but it's too prevalent that I feel like it needs to, like, there needs to be the other side of that story of like, hey, here's real information from a trusted local source.
So I think part of it is people getting the vaccine. If your family members, your friends, your neighbors, if your own healthcare provider is confident in getting the vaccine and they share their information and stories, IDPH is looking at and working on creating a Illinois COVID ambassador campaign. So we're awaiting more information on that, but that'll be for people who are kind of community leaders that are willing to be those ambassadors and share the information about the trusted sites and the information about where to go and those things. So I think it's partly that, and some people are never going to be interested. We're going to continue to have those. But if those who are interested and can obtain the vaccine can be those individuals that share their positive experiences and things, I think, it's just the world we live in.
Yeah. Well, any help to combat some of that, or just to provide another viewpoint of that, it seems so valuable, especially if it comes from a local, real, trusted source, as opposed to, like, I mean, I can find 300 sources that says that's absolutely positively not true, but it just becomes so easy to dismiss those when SAH or a local doctor or somebody can do Q&A of what bad information is circulating out there. That was so frustrating to me because I was sitting in an office where this person is sharing these, ill-informed opinions with other people going, yeah, I don't know if I'm going to get my vaccination either. And it's just like, it makes me crazy.
Yeah. So on the SIH website, if you would like to get information to share with others, and the Jackson County Health Department has great resources, and IDPH, CDC, again, those trusted sites. On our page, you have information here, like how to get your tests, the data that we publish each week, our hotline, how to sign up for our updates, those frequently asked questions that we're getting at our hotline. Then our staff are putting FAQs together for those and posting that. And again, it's all based on IDPH, CDC, other trusted sources. So if you just go to our main SIH page and just scroll down, you'll see this information in the boxes.
I just wanted to say thank you again for providing that. And my one last question is just to take that one step further, is anything that you could do to, provide resources to address bad information and correct it with real information, because unfortunately the truth is stranger than fiction about, like, some of the reasons that are circulating and being shared. And it's like, just having the correct information isn't enough. It's almost like you have to address the incorrect information and say, this is undeniably factually untrue, and here's a source that can dispel that myth. And I don't know, like I said, I just really appreciate having access to that. Thank you.
And like Kerri said at the beginning, the more you can do to help us spread the correct information and messages and kind of be those people that share it in your community and with your circles would be fantastic.
So I work for the Boy Scouts, and we've had to postpone a lot of our events. I work with a number of volunteers who are on both sides of the argument of, it's very frustrating to hear, but there are people who say, well, this is all fake. It's not actually a real thing. And, you've got the mask deniers and whatnot. And then we have people that are 100%. I work with a wide range of thought processes and political leanings and things like that. Where do we stand as far as additional guidance? I know right now we've, our own internal guidance, it comes from Illinois Department of Health, Missouri Department of Health, that we're recommending no indoor meetings right now if possible. Outdoor, no more than 10 people. Where do we, I know that our schools are starting to go back in person with hybrid learning and things like that. How soon with this vaccination rollout do you think we'll be able to open back up to probably not normal? I don't anticipate normal happening in 2021 even, but how soon do you think we might see phases roll back to allow more things like, a meeting of 25 people or?
So currently, it really has to do with, in Illinois, it's about the positivity rate, ICU beds. So that's really what we're tracking right now. So we're still in those tier 3 mitigations. We are not going to get the chance to roll back on the 15th as some of these counties are, or some of these regions in Illinois are. So that's continually what we're tracking, and we keep that up to date. Every week, we're putting that information out there. So that's really what's going to be the difference. So it's the positivity rate needs to go down, and we have to have a steady supply of vaccine and have so many people vaccinated. So that's kind of where we're at. I don't foresee that changing for a little while.
So yeah, one doctor told me when all this rolled, when everything kind of started back in March and April, that, opening back up isn't about the virus being gone. It's about an ICU bed open for you. The fact that we can open up isn't because we're defeating this. It's because we now have the capacity to take on more patients. And it's alarming to see what's happening in Los Angeles and in other parts of the country right now where they don't have the capacity. So, we'll continue to work from home in our bedrooms and things like that as long as we can. But I know for kids and for a lot of other people, we've been doing this for almost a year now, and it's frustrating. So I appreciate what both of you are doing to get the information out there. Everything that I have seen. What I'm surprised by is I'm learning today that that there's even the 3 phases of rollout for the vaccine, and I think that goes to show how many people are willing to share false things online. So the more we can do to promote that, internally and, within our Rotary Club and in our circles, I encourage everybody to do that, to share, hey, go to the Jackson County Health Department website tomorrow, tomorrow at noon, schedule your appointment, get vaccinated. So we appreciate you guys being here.
Thank you.
Thank you.
So it is 1 o'clock. Do we have any other questions or comments from our speakers or for our speakers? Okay. Well, I want to thank Kerri and Angie for joining us today. This was very insightful and great news to hear. So thank you so much.
And I am pasting, Kerri may have already pasted some of these things in, or someone else may have, but in your chat, I'm pasting things directly from their updates so that you have those and can go right. I know someone pasted a question about how you spell the Nexel and then their website, and then I will also add the SIH website. And please feel free to reach out to us, follow Facebook, and look at those websites.
Thank you so much, Angie. Next week, what's going on next week? We have our social event, our watch party for the U.S. presidential election. And Shane, can you confirm that is going to be through the same Zoom meeting? Are we going to do this through the same meeting?
Use the same Zoom meeting link. What we'll do is I'll open the room probably about 11:30ish. We'll have a live stream of the inauguration. I'll have the sound turned off so we can talk to each other while that's happening, and probably about the time that they're administering the oath of office, we'll probably turn the sound on and listen to that together. So if you'd like to come and communicate with your friends, that'd be great. Rick's bringing snacks to everybody's house by noon on Wednesday, so we'll be well fed and we'll enjoy this once every 4-year event together.
Thank you, Shane. On the 27th, we have, 27th, we have our interim police chief in Carbondale, Mr. Stan Reno, followed by the month of February. We've got SIU Africana Studies, Ms. Kathy Lively of Mantricon, Ronnie LaForge with the City of Carbondale, and Tom Davenport with the Carbondale Chamber of Commerce. So thank you, Linda, and the rest of the program committee for getting that set up. It's great to have some awesome guest speakers coming up, and the ones we've had so far this year have been great as well. Now it is time for the four-way test. Linda Meredith, could you please lead us in the four-way test?
Yes, I can. So would everybody join me in the four-way test of the things we think, say, or do? First, is it the truth? Second, is it fair to all concerned? Third, will it build goodwill and better friendships? And fourth, will it be beneficial to all concerned?
Okay.
Thank you so much, Linda, and thank you all for joining us today. That concludes our meeting. So.